Hi, my name is Vicki, and I'm here to do my community assessment project. And I chose Bristow, Oklahoma, because my youngest daughter just moved there with her newly married husband. So I decided to learn more about this community. Bristow is a small city located in Creek County with a population of approximately 4,000 people. Like many other cities in Oklahoma, Bristow faces various health challenges that affect the well being of its residents. A comprehensive health assessment is critical in identifying these health issues and developing interventions to address them. This paper presents an overview of the health assessments of Bristow, Oklahoma, including its physical, social, political, and economic aspects. The physical assessment: Bristow has a limited number of healthcare facilities, which poses a significant challenge to the residents seeking medical attention. There is only one hospital in the city and a few primary care clinics, resulting in longer wait times and overcrowding of healthcare facilities. Additionally, the lack of access of affordable healthcare services, particularly for low income residents, has contributed to poor health outcomes such as untreated chronic conditions. Sorry about that, I had to swallow. Some of the social um, my social assessment: Bristow has a relatively small population, and community-based organizations play a critical role in providing social support to its residents. The city is home to a few community centers and churches that provide services such as food banks and clothing donations to low-income families. However, there is a lack of mental health resources in the community, which is a significant concern given the high rates of depression and anxiety among residents. My political assessment done on Bristol's local government has the local government has a responsibility to prioritize the health and well-being of its residents. The city has implemented various incentives aimed at improving community health, including the establishment of a community garden and the introduction of bike trails. However, there is a need for further collaboration between the government and community organizations to address health disparities and improve access to health care. My economic assessment on Bristow is that its economy is largely dependent on the oil and gas industry and many residents working in that sector. The city has a relatively high poverty poverty rate, with a significant portion of the population struggling to afford basic necessities. The lack of affordable, health, healthy food options and safe recreational spaces is a significant concern, leading to poor health outcomes such as obesity and other chronic conditions. My nursing diagnosis, it would be based on the health assessment. The nursing diagnosis for Bristow, Oklahoma is ineffective community coping related to limited access to healthcare services, social isolation, and economic challenges. My nursing plan and implementation is to address this nursing diagnosis. The following nursing interventions can be implemented: collaborate with community-based organizations to establish mental health resources and support groups for residents struggling with depression and anxiety. Advocate for increased funding to improve access to affordable health care services for low-income residents. Promote healthy lifestyles by partnering with local businesses to provide healthy food options and establish safe recreational spaces. provide health education to residents on disease prevention and management, particularly for chronic conditions such as diabetes and heart disease. Another risk factor for Bristow, Oklahoma is the air pollution, and it is a high fire risk factor because of the dry lands out in Bristow, Oklahoma. My conclusion would be is that the health assessment of Bristow, Oklahoma reveals various health challenges facing the community. The lack of access to affordable health care services, mental health resources, and healthy food options contribute to poor health outcomes among the residents. Nursing interventions such as collaboration with community-based organizations advocating for increased funding, promoting healthy lifestyles, and providing health education can improve community health outcomes. By working collaboratively with the local government and healthcare providers and community organizations, Bristow can create a healthier and more resilient community. Thank you for letting me share about my community assessment project of Bristow, Oklahoma.